Good day to everyone. I am Dr. Kevin Francis Yu Ang, and I'll be presenting a business plan, a telehealth platform for ValuCare, a health maintenance organization. ValuCare is a managed care company established by a group of doctors that offers comprehensive healthcare coverage through outpatient, inpatient, emergency care, and dental benefits packaged and accessed via its vast network of accredited healthcare providers. It covers many medical diseases if or when it happens to you in the future. In line with the pandemic, there was a decrease in utilization rate in hospitals and clinics during the lockdown. On evaluation of the business process, there's a need to introduce product innovations in its current lineup of health insurance products. This is projected to increase the HMO's financials by 8% per year. The HMO plans to add innovations in their healthcare insurance products, acting as riders. The telemedicine and home health platform service can further enhance and increase the value of the company. ValuCare is an HMO. It basically sells healthcare insurance to the people, providing financial coverage for outpatient, inpatient, and ER use. If a person avails for this HMO product, he or she will get healthcare financial coverage. The HMO industry is a 51.5 billion peso industry led by MaxiCare and Medicard at 16 billion and 9.5 billion respectively. ValueCare has a peso market size of 1.9 billion pesos. The products of ValueCare include individual, family, and corporate HMO packages. It is key that the company works and coordinates with accredited hospitals and clinics since they will be the ones providing service for the patients and the customers. ValueCare has a total of 298,600 enrolled members in its database. The company serves corporations like PNB, BDO, SM, Ace Hardware, 7-Eleven, Landmark, and the following. These large volume companies are valued clients of the company. For healthcare needs, patients visit their doctors for checkup in the hospital. It is a need for the patients and the customers. But what if, due to the fear of going to hospitals, patients will be visited instead by the doctors? Within the safety of their homes, the patients will get the best medical care and treatment. It then becomes a need and a want. We can look into the why, what, which, who, when, where, and how of this business plan. In line with the COVID-19 pandemic, there is a change or shift in consumer behavior. In order to address these needs, there's a need to create a platform that can provide medical consults between ValueCare members and their doctors. This conduit will allow ValueCare members to communicate directly with the physicians for their healthcare needs. The customer segment that will be targeted involves the Class AB consumers who reside in big subdivisions in Metro Manila. Age range would be 25 to 65 years old. So further market research can be done to complete this business proposal. The design will be a focus group discussion, survey research, and data gathering. Globally, the telemedicine market has an optimistic outlook, having projected incomes increasing as time passes by. There are many countries who have already adapted to telemedicine, those in the Western and Eastern counterparts, which include our country, the Philippines. Now, what benefit can this telehealth platform give to our customers? It will be a hassle-free process. There will be a 24/7 teleconsult service anytime, anywhere, proper and compassionate patient care for the customers. Basic and important medications will be given to the patient as part of their home care kit provision. Diagnostic tests like blood tests, x-ray, and swab will be provided. Results will be sent out promptly. Ambulance conduction service may be given if needed. Issuance of medical certificates can be done, and the flexible payment options will also be offered to the clients. Here is the customer avatar for this particular service. Also addressing the problems, providing present solutions, and giving unique selling proposition for this. Initial survey was done which showed that doctors preferred using cell phones, they preferred using apps, they preferred appointment setups, and they usually do not give their contact numbers to the patients. Initial data on the subset of population was gathered, and it was found out that most of the customers in ValuCare are located in Quezon City. So for the place, it might be strategic to start from there as a pilot. Now, what is the product? The product is a telehealth home care program or service which is open to ValuCare members enrolled in the package. To qualify for this program, the ValuCare's members should have a swab RT-PCR positive with or without symptoms and residing in Metro Manila only. There will be two process flows, one for Program A for COVID mild and Program B for COVID moderate. Here is a process flow for the Program A COVID mild. And here is a breakdown of the costs, which include home care kit, teleconsult professional fees, and a PF with the nurse, having an OPEX of 4,169.75 pesos. On the other hand, here is Program B for COVID moderate, which includes more testing like CBC, chest x-ray, electrolytes, and the such, and more detailed visit from the doctor and the nurse. So this will be more expensive at 19,146 pesos. So here is a breakdown of the PESTEL analysis showing analysis of the economic, political, legal, sociocultural, environmental, and technological aspects for the business plan. In the competitive positioning map, ValuCare positions itself as having low-price insurance products for large business corporations. MaxiCare, on the other hand, focuses more on the small and medium enterprise companies at much lower price ranges. Medicard focuses more on the individual employee having customizable packages for every individual of any age. So these are the competitors in the HMO industry. Now, regarding the product, again, there will be roles and responsibilities of the doctors, and medical legal concerns will also be addressed. Now, the team has also constructed cases that can be managed via telemedicine and cases that cannot be managed via telemedicine. Now, who are the competitors in the telemedicine industry? They include Medgate Philippines, Consulta MD, MyDocNow, and Kitika. And each one of them has their own strengths and weaknesses, which can be seen here. The process flow for the ValuCare Teleconsult telehealth platform is further being discussed and polished, which include disclaimer, informed consent, data privacy concerns, general information and history taking, and proper documentation. I'd like to say that I have the drive and tenacity to pursue this business. I will sacrifice time, effort, and money to make this business work, and I shall sacrifice my existing lifestyle, endure emotional turmoil, and forego comfort to pursue. The 12 opportunity screens are also to be taken into consideration. Critical success factors include the following: price, scope, product, quality of service, advertising reach, location, and ISO accreditation. Here are the marketing strategies which can be further elaborated in the written paper that I have submitted. Financial projections are highly optimistic. So in 2020, the gross revenue of ValuCare based on estimated contract value was at 2 billion pesos. A large chunk came from renewal business at 87%. Introduction of this product innovation can further increase the revenue of the company. Program A would cost 5,000 pesos for the member, while Program B would cost 20,000 pesos for the member. Assuming that 3% of the current list of members will avail for these product innovations, these programs, there will be an increased revenue. But we have to take into consideration the decrease in COVID-19 cases as the years go by. The number of patients who may avail Program B, COVID with moderate symptoms, are also projected to decrease as less severe cases may occur as more vaccinations take place from this time forward. So generally, for the next 5 years, the outlook will be positive generally, as there will be a positive net operating income as more and more people avail of these programs. ValuCare should expand and focus on product development and take advantage of the COVID-19 situation. This strategy is projected to increase the HMO's financials by 8% each year. The HMO plans to add innovations in their products, and acting as riders, the telemedicine and home health platform service can further enhance and increase the value of the company. Once again, thank you very much. Have a good day.